April is Oral Care Awareness Month, and did you know that more than 50,000 people worldwide will be diagnosed with oral cancer? It's a disease that occurs in those over 50. The earliest detection is always the best, and we went to South Coast Smiles to see just how they screen.
If you haven't been for a regular checkup at the dentist, you need to. It could save your life.
April is Oral Cancer Awareness Month, and here at South Coast Smiles, one of the things we pride ourselves on is educating our patients. Coming to the dentist for those oral cancer screenings, it's really the first line of defense. In 2017, 50,000 people in the U.S., and that's just the U.S. alone, and not worldwide, just the U.S. alone. So oral cancer is a disease that is extremely debilitating, it's very aggressive, and also very difficult to treat.
The chances of men having oral cancer are greater than women.
The average age upon diagnosis is around 60, but like I said, now we're seeing a little bit of a different trend where people who are younger are actually being diagnosed, and that's because there's certain behaviors and habits people engage in that put them at a higher risk for developing the disease.
The main cause of oral cancer probably won't surprise you.
Tobacco, whether it's chewing tobacco or smoking, excessive alcohol consumption, that's also a risk factor, and then the riskiest factor of all is human papillomavirus, also known as HPV.
The trained dentists at South Coast Smiles know just what to look for.
Visually, there are things you can look at and see in your mouth. For example, if you see some irregularities, bumps around your lip within your mouth that are irregular in size, discoloration, reddish patches, whitish patches, that's something to really be aware of and see your dental provider. Also, chronic hoarseness in the voice, difficulty swallowing, maybe a chronic cough, or feeling as though you've got something in the back of your throat and you just, when you swallow, there's that difficulty in swallowing and you just can't get rid of that feeling that there's something in the back of the throat. Also, bleeding in the mouth that you just can't explain where it's coming from. Even finally, if you're feeling a numbness or a tingling in areas of the mouth, these are all signs, symptoms, reasons for you to see your dentist immediately.
As with everything, the sooner it's caught, the better for the patient.
There are treatments for it, but it is a very aggressive disease. So coming to your dentist regularly, we are that first defense when it comes to diagnosis and when it comes to patient education. We do oral cancer screenings. They are at absolutely no cost to the patient. We do an oral cancer screening at a patient's hygiene appointment. We do oral cancer screenings even as doctors are doing treatment as well. We do have a very special instrument that we use. It's called the Veloscope. And that's something we employ as well in our screenings. We do oral cancer screenings really all the time, being vigilant, looking for changes within your mouth. Very important as a patient and very important for us to spread that message to the community.
And it really is so important to go and get that checkup. And if you notice any signs, don't wait. Make that appointment. We will post a link on our site, roadshow.com.